The Kwale government has launched a CT scan block as well as an ICU unit to cater to the county residents and its environs. This is the second one after the Coast General Hospital, and Victor Gale is there. Victor.
Here in the coastal region, rather in Kwale County, after the launch of the CT scan unit together with an ICU unit. Remember, this is among the biggest ICU facilities that we have in the country currently, compared to big hospitals such as the Kenyatta National Hospital and the Mama Lucy Kibaki Hospital in Nairobi. And with me, just to decipher more of the kind of gadgets that are here, or the facilities that are here, is Dr. John Betunda. Betunda, just explain to us a bit what these machines are and the capacity of this particular facility.
Thank you for this opportunity. I would want to first start by appreciating the national government and the county government for giving us this facility. So part of this project has been equipping the ICU with these machines. As you can see, this machine is a mechanical ventilator. Its work is basically to support breathing or respirations or ventilation for a patient that is not able to maintain adequate breathing. So this is the work that it does. Then from the mechanical ventilator, as part of the bed unit, we have the bed. This bed is manipulatable. It can be adjusted into various positions. As you can see, we have two kind of mattresses. The one is a normal mattress. The second one is called a ripple mattress. Now, the work of this ripple mattress is to reduce pressure on the patient lying on this mattress so that we prevent the aspect of the patient developing pressure sores or bed sores. So how it works is that it has an electrical system of inflating the mattress. And then on inflation, it inflates in alternating fashion. As you can see, if I press here, you can see this one is fully inflated, but when you go to the next one is deflated. So it's able to alternate that pressure. In the next turn, this part that is deflated will be inflated, and the part that is inflated will be deflated. Then moving to the units, we can be able to monitor what the patient's vital signs are, what we are able to read from the patient, we can be able to project on a screen. And then we have the machineries that can be able to give medications to this patient that is lying here.
Well, I will just move a little bit next here, and as Kwale County Governor Salim Vuria. Governor, very good afternoon. Welcome to KTN News. How has the journey been in terms of launching these facilities together with this ICU unit and the CT scan unit?
Thank you very much. First of all, I'm very happy today that we are launching and officially opening the second ICU in the region. We now only have an ICU in Coast General and in Msambweni here in Kwale County in a public hospital. I know there are others in private hospitals, but for public hospitals, this is the second one in the region. And we began this journey in 2013, when we took over leadership. And one of our dreams, actually, my dreams as the governor and my deputy, is to have Msambweni Hospital to be a full referral hospital. And therefore, a full referral hospital requires an ICU, it requires a renal unit, it requires a functional CT scan. And therefore, the renal unit functioned earlier. And together with the national government, when the president visited, we didn't have the equipment here, we had the building. And therefore, he was very, very impressed, and he committed to partner with the Kwale County government to ensure that this project is successful. And therefore, together, we joined hands with the national government, and they have assisted us with equipment worth 250 million. And this is not for the leasing. This is equipment which they supported after the president visited, and we had already done the building and the basics for a functional ICU. So I'm a very happy governor here today to say that now with this ICU, Msambweni Hospital can now operate as a referral. And I have already confirmed that there are patients from even as far as Kilifi who have been referred here. and therefore this is a journey that we will continue to do. Already we are doing a model maternity unit, which we are going to do at a cost of 78 million just outside. It's an ongoing project. We are also doing a blood bank, which is also complete. We've brought the basic equipment and we continue to finalize. We'll open it soon. And therefore this means that the Kwale County will never be the same with this particular project.
Maybe a final one, Mheshimiwa. We have the devolution conference just around the corner. Maybe when you go there, will this be among some of the milestones that will be showcased there? Also looking at devolution as a whole, can we see that perhaps devolution has come to help Kenyans as compared to before?
I think with this project that we are opening here today, I can now confirm, to the people of Kwale and all Kenyans that devolution is working, and you can see it is evident that now healthcare will improve in our county, and with the many projects we are doing in this hospital and in the entire county, we are also laying a foundation for universal healthcare in the county, which we will also be starting soon as part of the agenda, the 4 agenda item that the president has committed to do. Yeah.
Thank you very much. That was Kwale County Governor Salim Mvurya. Now I'm going to talk to the Deputy Governor, that is Fatuma Chani. Fatuma, very good afternoon. And I can see you next to the baby incubator, which also is in this ICU facility. In terms of women and healthcare in Kwale County, and we are aware there's a maternity unit that is being built outside there. What can you comment? What can you say about that?
Okay, first of all, we appreciate the leadership of Kwale County, the leadership of His Excellency Governor Mvurya. We also appreciate His Excellency the President of the Republic of Kenya for supporting us in making sure that Msambweni Referral Hospital is in a working condition, good working condition. Here we are in ICU. We are not only doing the ICU, we also have the modern maternity, which we are doing, which have a capacity of 72 beds. We are not only doing the maternity or Msambweni referral hospitals, we are also doing maternity in each and every dispensary. We've done around 30-something dispensaries, new dispensaries, and in each dispensary we are doing a maternity. This is to make sure that the lives of our people are less. We are helping our people to make sure that they don't suffer because of long distances to reach medical facilities. So we are doing so much to make sure that our people get good services. We've hired more medical staff. For this ICU, we have 10 staff, and we have already advertised for more. We've moved from a staff capacity of I think we've gone to around 1,000 and something plus. This is to make sure that each and every dispensary has an attendant each and every time. We're also doing staff houses in each dispensary to make sure that even at night, the medical staff are there. So we are trying as much as we can, and I think Kwale is no longer the same. We are moving forward. We welcome the national government to support us more, and even the donors. We also appreciate GIZ, which has supported us in doing the blood bank.
Well, thank you very much. A very eloquent Deputy Governor there, just giving us the figures, the facts about Kwale County in terms of health, maternal health care. Indeed, here at the Msambweni County Referral Hospital, where the county government has just launched an up-to-date and up-to-standard state-of-art ICU unit together with the CT scan block. And together, the governor has already said that they are putting up a 78 million maternity wing that will have a holding capacity, or rather bed capacity, of 72 beds that they expect is going to be a great milestone in terms of healthcare, not only in Kwale County or not only in Msambweni, but in the Greater Coast region, and together with the neighboring countries such as Tanzania, whom we also have patients trickling into Kwale County. Back to you, Ashley.
All right, many thanks there, Victor Ogali.